So now that we have a better understanding of what's going on with muscles, let's talk about some sort of issues that happen with muscles. And since I'm a microbiologist, let's talk about the two that I think about most. Tetanus. So tetanus, you remember back when we were talking about tetanus, we were talking about the muscle completely contracted. So all of the muscle had been pulling on each other, and we had something that sort of looked like this. Well, tetanus is a bacteria that produces a toxin. And what happens with this toxin is it basically makes it so that acetylcholine floods the motor unit and makes it so you completely squeeze, and it also inhibits acetylcholine esterase. So now what's happening is over time your muscles are contracted to its most, it's basically squeezing as much as it can. All of your muscles are in tension and there's no release. So what ends up happening with these people is, of course, this is very, very painful because everything is starting to lock up. Their jaw is locked. So sometimes people will say locked jaw is one of the things that happen with this because the jaw does lock up. Your arms lock up. Your body is in this complete tension. And basically what happens is they produce a bunch of lactic acid, and of course without treatment they will die. Botulism is the complete opposite. Botulism, and you get this from cans that are haven't been pasteurized or heated up to a certain level, and this bacteria sort of lives in this unoxygenated environment, and it has a whole bunch of sugar, whatever's in that can, and starts to grow a lot. Usually you know if the can has issues because it'll start to poof out. And it's just because the bacterium produces a gas, and it's so strong in there that the can sort of becomes sort of bowed on both sides and on the outside. What happens with this toxin is it makes it so acetylcholine can't get released. And when acetylcholine can't get released, patients are usually really limp. So you could see with this patient is muscle control is not really there. You could see that they're completely limp. They can't really open their eyes or their mouth. Eventually what happens is they have respiratory arrest because you can imagine if you can't control your diaphragm and your intercostal muscles, you can't open and close your lungs, and of course you die. And then muscle tone. Muscle tone is something that you hear periodically, and basically muscle tone is the central nervous system tries to create an ideal length of these sarcomeres, and it's basically where the muscle is overlapped optimally. So here we're completely contracted, here we're sort of at rest, this would be muscle tone, and then eventually this is you stretching. So this would be the intermediate point of where the muscle is at its optimal happy zone, and this would be right in this zone. So a quick review is that motor units, the more you use, the stronger they are. A stimulation is multiple quick neurons that release that calcium to get more contraction to occur, and that's basically going to affect the length and the tension relationship, which is going to make it so there is those actin and myosin start to bind on each other, and they can control the length of the muscles and how tense, how much strength they should add with that muscle.